Welcome back to our channel Nursing Learners. Today we are going to discuss a short important topic. It is very important for all nursing exams, that is ORS, Oral Rehydration Solution. Please all of you take your notes. Okay. First, what is ORS? ORS, it is a salt which is used to treat dehydration through the oral route. Next, what is the composition of the ORS according to WHO? Each sachet, that is each packet, contains 20.5 grams of ORS powder. Okay. In that, sodium chloride 2.6 grams, sodium citrate 2.9 grams, potassium chloride 1.5 grams, and dextrose anhydrous is 13.5 grams. Total 20.5 grams. Okay. One sachet of ORS should be dissolved into 1 liter of water. Okay. Then the concentration of electrolyte is as per the sodium is 75 mol per liter, potassium chloride is 20 mol per liter, chloride is 65 mol per liter, citrate 10 mol per liter, dextrose 75 mol per liter. Okay. Total osmolarity is 245 osmol per liter. Okay. Normal osmotic fluid of our body is 270 to 310 mol per liter. As we already discussed about that, the total osmolarity of ORS is 245 osmol per liter. So, the ORS is a hypotonic solution. Next, ORS dosage. After each loose motion, how much ORS we should give to the persons. Okay. As per age, here there is some criteria. Okay. The first, birth to 2 years, 50 to 100 ml. 2 to 10 years, 100 to 200 ml you should give. Next, above 10 years, as much as they can take. How much they can take, they can drink. Okay. Is ORS can be combined with zinc? Yes, ORS can be combined with zinc tablets to prevent deaths caused by acute watery diarrhea. Zinc tablets for 14 days OD. Thank you for watching my video. Please subscribe, like and share to your friends. Thank you.